you're having a great 12th of July, and it being 14 minutes past 9 in the morning, we still welcome you to Smart 24 TV, and you're watching SMB Smart Means Business. At this particular hour, we dive into our topical discussion, and this time we're going to follow up on COVID-19 vaccination procurement and processes. And now we're going to go into a short break. We do return. 15 minutes past 9 in the morning. We hope you're having a great morning. For now, let's get into our topical discussion where we are following up on COVID vaccination, procurement and processes. Joining me now is Ainebiona Emmanuel, who is the PRO at the Ministry of Health, to discuss this and more related issues. Thank you for joining us right here on Smart 24 TV. A very good morning.
Good morning, viewers, and thank you for having me.
Very well. If you could just relate for us, how are we doing into the country regarding the current stand of the country in the COVID-19 crisis handling the pandemic?
Thank you very much. Uganda is in its current second wave, and we have seen a number of increased cases and even deaths, but in terms of cumulative numbers, I can just recap as of 9th July, we had 277 cumulative COVID cases. We have had about 61,304 recoveries, and of these we have about 996 who are admitted in our various hospitals. We have registered 2,104 deaths since the outbreak of the pandemic in March 2020. And we have administered about 1,058,000 vaccines. We have conducted over 1.3 million tests in our various laboratories. Yes, so that's where we stand in terms of numbers, and we continue fighting on as a health sector.
And we greatly appreciate your implementations and improvement, which is why we begin it on the vaccination concern. We appreciate the fact that you have vaccinated over 1 million people. And now Honorable Acheng last week and the Permanent Secretary Diana Twine had appeared before Parliament's COVID-19 task force, which was scrutinizing interventions put in place to tackle the COVID-19 pandemic, including vaccine procurement, payment of medical workers, and health service challenges. The MPs tasked Acheng to explain where the funds had, all the funds amounting to over 121 billion. She could not give clear explanation meant for purchasing vaccines that had gone since 2020. Has the ministry come up with an explanation yet as of now?
I think explanation was given if you followed closely. We have been waiting for the availability of these vaccines on the global market, and most of the vaccines had been booked or bought by big these more developed countries. Uganda has put orders for vaccines about 9 million, and we had put this into Serum Institute of India. But when there was a crisis that you saw on international media in India,
about AstraZeneca vaccine?
Yes, yeah, India decided to hold all the exportation of the AstraZeneca COVID vaccine. So that made it impossible for us to get the readily available, to get vaccines because they were not readily available. So we opted to go through the COVAX facility, which is an initiative that was put in place by Gavi, World Health Organization, and UNICEF to see how best low-developed countries like Uganda would access these vaccines. And even the few we've had, these over 1 million vaccines, have come through as a donation through the COVAX facility. But even the facility has not been able to get the vaccines. But the good thing is that while we decided to channel our funds through the COVAX, it already had agreements with various manufacturers in Europe, in India, and in South Korea. So we are now waiting for a delivery of these vaccines, about 9 million, and I see that the cost sharing agreements were signed and submitted on the 30th of June. So the supply offering notices have already come through for both the AstraZeneca, but we're also likely to get the Johnson & Johnson 2 million doses, which will come, these ones will come through any time. We also expect this month, like around 27th July, we're expecting 286,000 doses, 286,000 doses of the AstraZeneca vaccine from the COVAX. We also expect another batch of 688,000
next month.
Also, this is early August, but we are also receiving about 64,000 doses of the Pfizer vaccine, which are likely to arrive this month.
Okay,
yes.
This is where we want to dive and understand vaccine procurement in the country.
Yes.
Let us start with you said all these are donations. I quote your previous statement.
The first ones, but 9 million doses that also include 2 million of the Johnson & Johnson are being procured by government using government funds. The monies that were talked about in Parliament. And we are channeling this through the COVAX to enable us acquire these vaccines. But also various options are being looked at. We are planning to see whether we can acquire vaccines from Cuba, from Russia, but all these are all still discussions.
Yes, to begin with the COVAX procurement from the World Health Organization. Yes. Actually, the World Health Organization came to approve that is 2 weeks back or 3 weeks back, when it approved around 51 African countries to get COVID vaccines through COVAX and UNICEF. And is that what you're talking about?
This is originally what the COVAX had committed to Uganda as a donation. And this was confirmed last year, and we are expected to get 3.5 million doses. That is as a donation. Of this, they managed to give us 864,000, the initial doses that arrived in March. And these ones took us up to...
The initial arrival was AstraZeneca vaccine.
And it was a donation, yeah, it was a donation from COVAX. We also received about 100,000 as a donation from the Indian government. They arrived all in March.
Almost at the same time, and that is what pushed the over 1 million to get vaccinated.
So we
in the first
recently
place.
got another 175,000 doses from the French government, but also through the COVAX facility. And that's what we have now been using for this
Was that
exercise.
AstraZeneca as well?
It was also AstraZeneca. So as I said, we are now this month expecting a batch of 286,080 doses of the AstraZeneca vaccine. It's also going to be a donation, but through COVAX. These arrive between 21st and 27th this month. We also expect another batch of AstraZeneca of 688,000 doses, still from the AstraZeneca. But as I indicated, those being procured by Uganda, but through COVAX facility, the 9 million doses. The agreements have been
Sorry
signed.
to just interject. If you say you're procuring from Uganda, but you're saying this
We are
is a
procuring for
donation.
Uganda.
Yes.
I've told you the donations, they are separate batches, but the 9 million are paid for by the government of Uganda, but
Okay.
through the COVAX facility. Why? Why through the COVAX facility? Because it already has agreements
Okay.
with manufacturers.
Okay.
Yes.
I agree with that. I understand that now. And how true is it that from the previous parliamentary sessions, the ministers expressed their concern that actually we have not procured with our money?
That's why no vaccines have arrived using
But
our
they have
money.
been in process.
But it's in process. Only that the vaccines.
How much
on
money
the-
are we talking about here?
The actual figure, because they've been adding, so I don't know. There was an initial release, so I need to cross-check the figure. But if we were at Parliament, that figure was given by the minister and the peers.
Yeah, like also as you say, like you keep on adding the figures, so
The-
we cannot
as
tell.
finance avails money, so we keep adding to our quantities for the vaccines.
Okay, very well. And
Yes.
we're also speaking about Johnson & Johnson vaccination procurement.
Yes.
How does that affect people who are already getting AstraZeneca vaccine with Johnson & Johnson?
No, because we are targeting to vaccinate about 22 million.
I mean, is
Ugandans.
there where you have put that you're going to have people identified, those who got AstraZeneca?
Of course, we have a record, we have a database, and we are also giving vaccination cards that specifically indicate which vaccine you got and which batch for traceability. And we have a system that will, if someone, for instance, has taken 2 jabs of the AstraZeneca vaccine, our system now will generate you a vaccination certificate, what you use for travel. So you cannot come now and you've taken 2 doses of the AstraZeneca vaccine and you want to claim now to take a Johnson &
Johnson & Johnson.
The system will already show this person, based even on your national identification number, the NIN, is already vaccinated, double vaccinated. So we will be targeting people who have not received any jab.
Yes. According to the World Health Organization, the purchase of vaccine through COVAX actually has got some terms and conditions. Is there something Ugandans would need to know about these terms and conditions and how our country has come into an agreement with WHO?
Really basically is now how this vaccination will be purchased, which are bilateral agreements between Uganda and COVAX, and how they will be shipped. So there is no other terms for those ones which we are using Ugandan money to pay. Yes.
Okay, still moving on, with me is Ainebiona Emmanuel, who is the PRO or the Ministry of Health, discussing and following up on vaccine procurement and processes. And if you have been following, or if in case you just missed, you can still follow on our YouTube platforms. We are still moving on the issues of vaccination into the country. There has been a challenge. I do not know if you have seen reports whereby over 800 workers from private companies were actually vaccinated with fake vaccines, and people were arrested.
Yes,
how did that skip ministry?
No, we are doing investigations, and it was through our exercise, because you are very much aware there are some pharmacies that were found with vaccines, government vaccines. So this racket that was administering what we are yet to identify were arrested as part of our exercise with police. Yes, so it did not escape us. It was already a system we had put in place.
You had put in place to track.
To track these people. So now the contents of those viruses they had are being tested in the government analytical lab,
okay,
to know what exactly people were injected with.
Okay.
Yes.
How are you even holding it up for the people who were vaccinated with fake vaccination? How has the ministry followed?
No one has come out to complain of any abnormal side effects. So that's why we know
that's why you relaxed?
No, that's why we are confident as investigations go on. We are sure that this that was injected to people was either not harmful, but the laboratory findings will give us a true picture of what it is that we have. Was it a COVID vaccine? Was it any other substance that the laboratory has to say? But no one among those people who were vaccinated has come out to say that either
we are having a challenge.
I am feeling strange, or I have had a challenge. So
I understand that.
Yes.
But as a ministry, have you taken any, taken it upon yourselves to find out?
Yeah, we called upon anyone, the
risks?
companies that were affected, and we tell them in case of anything they need to report, and also through the National Drug Authority.
So how many companies, if you roughly estimate for us that you
I'm told there were 2 companies. I might not say their names, but these unscrupulous people. That's why we've been saying the government vaccine is free and available at the vaccination centers. But companies that decide to have special arrangements with unscrupulous people we don't know, then sometimes they take the fault.
They take the blame.
They take the blame, because we've clearly told you these are our vaccination centers. Individuals should be guided to go to this vaccination center, and our vaccine is not paid for. So if you choose to go through unscrupulous people, to invite them to your premises, you also have to take some responsibility. And if I was a health worker in those facilities, I would hold the management that invited these people
accountable for that particular cause. Yes, still moving on, let's look at other donations away from excuse me, away from the vaccine. We have the UK responding to UNICEF Uganda purchase of oxygen plants with life-saving support benefiting over 1.8 million people. What criteria was even used by the ministry to come up with the list of people or hospitals that are going to, to be benefiting direct of the supplements of oxygen plants? Because we have got priorities in this, or is the ministry aware about this? Because I understand, of course, it's the one that gives directives. The UK responded to the UNICEF Uganda, giving it oxygen appeals that will be benefiting 1.8 million people. And we see the selected hospitals around here. We have National Referral Hospital, we have Nambole, we have Soroti Regional Referral Hospital, we have Umbale Regional Referral Hospital and Moroto Regional Referral Hospital, and the provision of operational support of oxygen, boosting Uganda's oxygen production capabilities. As a ministry, what criteria did you use maybe to supply or implement these oxygen plants to these different regional referral hospitals?
No,
there are 4 main regional referral hospitals.
If you've seen is the donation that is coming from the UK government, yes, through UNICEF, and those that are being supplied are our high volume COVID treatment facilities. What do I mean high volume? These are the centers that have a large number of patients
of COVID-19
who need oxygen support. So that is basically the criteria.
But Ms. Tainebiona, do you know actually that there are other people dying, even at least approximately to that percentage of people in Soroti that are up?
Yes, but Soroti, we already have other mechanisms of making oxygen available.
Okay.
Most of these referral hospitals already have existing oxygen plants. But the COVID, a patient requires so much oxygen beyond the normal ICU patient. So that's why we have needed extra oxygen beyond what the capacity of the already existing plants. So what are we doing to ensure that we have oxygen is ensuring that we have enough cylinders, because this oxygen is transported in cylinders.
Okay.
So most of there were a number of private sector-led companies that have oxygen plants that stepped in, like roofings, steel and tube.
To give in cylinders?
To give us oxygen.
Oxygen.
So government had to find more cylinders. We were even expecting about 3,800 more through Global Fund to supplement our current capacity in terms of oxygen cylinders. Because most patients will need oxygen by the bedside. And most of these facilities have not been upgraded to have piped oxygen. Mulago has piped oxygen. What do I mean piped oxygen? From the plant, oxygen goes straight to the
Where
bed.
does Mulago get the plant from?
We installed 4 plants
around
at the
Mulago?
beginning of the pandemic.
Okay.
But also those 4 plants were, when COVID cases hit high in this wave, the capacity was still not enough. So we are currently, there is another additional oxygen plant that has been installed to supplement the earlier installed 4 plants.
Okay, I understand that. So why is it that actually oxygen is very expensive at Mulago?
No, oxygen at Mulago is provided for free. And also COVID care at Mulago is taken care of by government.
We have had reports and friends going to Mulago somewhere they are charged.
Not at Mulago. Mulago COVID treatment, if you had even
COVID treatment is free.
Semuju Ibrahim Nganda, who had her mother treated
his mother.
So that shows you there is no cost levied on any patient. Even me last year in August, when I got COVID, I got treatment, but I came out without even paying a penny. So that is what every patient who goes at Mulago. But unfortunately, Mulago has a capacity that it can't stretch beyond. So once the facility is full, it is full. So that's why other patients have found it hard to get services from private care providers. But also Nambole has space. So it's a matter of the choice someone makes. But government facility treatment, oxygen is free.
for the citizens.
Yes.
Congratulations, I can say welcome back from, a fight of COVID-19.
But I was not as bad as how people have been affected this current wave.
Okay,
Yes.
we're still discussing on two other, other support or other donations in regard to COVID-19. Where does it concern the Ministry of Health, seeing that, every donation coming out or every implementations, procurements, even government has decreased the budget at 40%. Getting the 600 billion to cater for COVID-19. As a ministry, where do you feel that, where do you derive, your stability as a ministry to say that we are really now stable, or you're still wanting more? When we see that there are other imbalances in the country, not only COVID-19.
You see, we still need more funding as the health sector. If we were able to get the 15% funding of the budget as
am I the only one who is seeing that funding is really coming at a high rate?
Because of
and continuously, leaving other
it's
sectors
because
lagging.
of COVID, but this has not been the case. The reason why there is increased funding is that we have a pandemic to handle now. But even that funding is not enough to meet the needs of the Ugandan healthcare system. Because we would need averagely 15% of the national budget as per the Abuja Declaration. That would be maybe the gold standard to have a cross-sectional delivery of the services Ugandans need. But we averagely get around 8% of the budget, meaning that we, by the financial, we find where we have unfunded priorities. Would wish to have like extra ambulances, would wish to have extra healthcare workers, but because there is no budget line for that item, we don't get to increase. Because like now with COVID, we would need what they call intensivists. These are people who attend to critically ill people while they are in ICU. But the challenge we've had is that some of these ICU equipments come, but there is no one to operate them. So those
no one to operate in terms we don't have
the experts who are supposed to operate them. For instance, every patient in ICU needs a doctor who is a specialized intensivist and an intensive care nurse. So you find, for instance, most of these experts are concentrated around Kampala Metropolitan. So if you take an ICU unit, for instance, Kabale, they might have 1 or 2, which means we are currently now in the process of recruiting more intensive care nurses. We've trained during this period, we've trained over 400, but still we need more, because each COVID patient would need, who is in critical care, would need a specific dedicated intensive care nurse. So, but COVID is expensive. Yes.
I do understand. I do not know what capacity we are at now in the country in regards to a percentage that we are at this percent.
Because we've not done any
managing in regards to according to the funds given, and we need maybe a certain percentage. If you could be clear that we are
that one
40,
it will need an audit by the health accounts, which normally there is a study done by the health accounts, which is part of the tools, to determine how much would require, for instance, to handle COVID patients.
Have you done that as a ministry?
It happens every year, so we expect that this is a process that is ongoing. So at a later stage, we might have to know what should we have required as a country against what. But also we already have a resurgence plan that we go by. So when the minister, for instance, requested recently, she said we needed like around 1.7 trillion. But that money is not readily available. We have like half of that.
Is that why you have not yet fulfilled the promise you made of over, 4,000 ICUs in upcountry regions? Could it be that they are not?
No, we are looking at, the president had asked us to
over 40,000
42,000 beds.
Yes.
Those included standard beds and ICU beds. So
Could it be the reason holding
partly that is the reason, because we would need to have all these beds at a go.
Okay.
But like for instance, now we are in the process of having 15,000 dedicated COVID beds. That's outside beds for other conditions. So, but if we were to have maximum need to take care of the COVID needs, we would need over 42,000 beds. So when we look at what we are doing and our target of now getting 10,000, we find we have a gap of 27,000 which needs to be funded. But if the funds are made available, then we can have these beds or procured, ready to attend to patients. So partly we need more resources.
Okay, and also if you could convince Ugandans that the Ministry of Health is not neglecting other patients or other, hospitable cases. For example, we've got HIV people suffering right now, being neglected. The COVID-19, aspect.
No, they are not neglected, and that's
like
why
I'm saying,
we have
you need to
continuous
convince people
care.
that you're continuously
Because
working
patients
on
are
other
there and
people.
there
We have
is-
people suffering mentally, mental disorders.
Yes, even over the weekend we had a discussion over mental health.
Yes.
What people need to do to receive mental care. But we have what we call continuity of care. Continuity of other health services. People are getting malaria. People who are on ARVs need to get their ARVs. People who have TB need to get their drugs. So all this we plan within the response. So there is a dedicated pillar to ensure that mothers are delivering and they are getting this service. So although there might be challenges, for instance, of movement, but we clearly indicated that a patient, a health worker who can identify themselves with their with their work ID for health workers, patients who have medical records, for instance, getting antiretroviral treatment for those living with HIV, should be led to get
Can
their
I just
treatment.
walk on a border or be on a border with my book?
Yes,
of HIV?
so long as
Is that
it's
okay?
so long as it's clearly evident, not like that clip you've seen making rounds, where someone has a fake cannula.
Was
to
that really a
disguise.
fake cannula?
It was a very fake cannula. Someone just got gauze and attached it to the top of the surface to hoodwink the security personnel, but they were very alert.
What if it was true? What if it was
Of
true?
course,
and the bleeding
they
is
would
there? Where could the
obviously
contamination-
fix another one. Because the camera is always fixed on the surface and it can get out. Yeah, but we realize that she should have had supplementary medical record showing,
We mean
showing
there,
that,
you
yes.
know, getting into contact
No,
with
but
the
if you have
strangers,
the
touching
cannula,
your cannula, there is blood movement there.
She should have had a medical form
Okay.
saying I'm receiving treatment. Because a cannula means that you're receiving treatment. You're going for either an extra IV injection that is passed through the cannula, and you should have a medical record that I'm going to clinic X and this is the treatment I'm receiving. But she had nothing to show. That's why the so inquisitive security people tried to establish, is this a genuine cannula or not? And indeed, when they tried to check, it was a fictitious cannula, meaning this person just wanted to break the presidential directives.
Okay, so just to make it clear, so people do not just need an LOC1 letter. If they have their book showing their records, hospital records,
For
they can go
avoidance
to the border.
the avoidance of being mistaken, if you have access to your LOC1, get a letter. If you know you are going, for instance, you are a pregnant mother and your due date is soon, and you've not been going to hospital, you do not have, for instance, an antenatal card, then you better get clearance from your LOC1.
You see, there are easier
But
issues,
if you
but how
have-
can I be just HIV positive?
No,
and
an
go to my
HIV patient,
LOC1?
an HIV patient or person living with HIV already has proof,
Okay.
previous medical records.
So they just need their previous
Yeah,
medical
to
records.
allow them to move.
Okay, still moving on, we want, at least you have answered some of the hopes. What are some of more hopes that people can get from the Ministry of Health in this trying time, not only looking at COVID-19?
The Ministry of Health continues to avail services to all Ugandans, and this is done through various interventions. We have vaccination for children, immunization for the 13 killer diseases. So parents, whenever your child is due for immunization, the newborns, they need to receive this immunization, which is free of charge.
I understand, because
People
why I
who
said,
need to be tested, for instance, even COVID, we've put testing kits, both PCR machines at regional referral hospitals to do PCR tests.
For
We
free.
no longer need samples to come to Kampala for free. We have rapid diagnostic test kits, the ones that take about 15 minutes. We have also put them at
the regional
at health
referral
centers, every health center,
every health center
to
has,
do a quick RDT for someone who comes with COVID-related symptoms, such that we are able to test these people.
okay.
We have various interventions, the laboratory, malaria treatment. So people should feel free to seek these services because they are meant for them.
Yes, you know why I asked hopes?
Yes.
Because we have had hiking of prices. How far have you mitigated the private sector with the, people being treated a day 5 million shillings for COVID-19? How can they be hopeful that you're helping out? How far have you reached? And also address the issue of now we have at least Covidex in the country. How are you going to help it at least reach people? It's prevention is better than, cure. Is it called prevention is better than cure, Babu? Like how, if we have Covidex in the country, how are you going to mitigate?
Yeah, Covidex is a
now,
it's a new herbal drug.
Yes, now it
which
has been
has
approved. It's
They
approved.
approved, it was notified, and it's a process. As
Okay.
you saw, if you read properly the statement of the National
Drug Authority.
Covidex is not a cure for COVID.
It's not absolutely, it's not
It
a
is
cure.
a supportive treatment for viral infection.
Infections, yes.
So that is why it was given notification as a herbal drug. And clearly the statement indicated this drug still needs to undergo clinical trials. That's why World Health Organization cannot recognize such a
It has
treatment.
not yet been recognized by World
Yeah,
Health
it has to
Organization.
undergo as a standard,
Okay.
safety standards, efficacy, if you take it, to what extent does it protect you? So all those phases of clinical trials.
Okay.
It
When
has to
proven,
undergo.
when
So
proven
for
by
now,
World Health
it was
Organization, are you going to support?
given a notification to allow the innovator go to those other stages of
Okay.
trials. So it is something we will continue studying. Once it meets all the standards, the procedures, the trials, then
As it is in public already
yes,
working.
it will be formally adopted.
Okay.
But before that, it cannot be formally put into our
And
essentials. It is appreciated now as the researchers and the developer now try to observe how it's performing. And that's why it was notification. But people should understand it's not a cure for COVID.
Address on the issue of private sector.
Yeah, we have had engagements with private sector facilities, and we come to a conclusion that critical care for COVID is very expensive based on the items one patient will require while in ICU. Averagely, a day in ICU, someone will use items about 3 million on a daily basis. So we had an agreement to see how best we can support these health providers, for instance, making oxygen available, ensuring that the drugs they are using are not, they are made available at a standard price. So there are interventions, and we hope in the few days
We shall see implementation of that.
Federation will be coming out to provide the standardized fees across most private facilities.
So we expect a standard fee across.
Yeah, for a COVID patient.
Okay, and we are soon concluding, Mr. Inebiona. We have seen last Friday you were among the people at Nambole COVID Treatment Center with His High Excellency Natalia Brown, which Nambole has been actually reactivated on 28th May. What is the fear?
No, we set up the Nambole Auxiliary Treatment Center as a facility to attend and respond to the highly rising cases of COVID. And it can be scaled up to 2,000 beds. So on Friday, the Excellency, the U.S. Ambassador, visited to check on the health workers and also the patients. And she greatly appreciated the facility because it attends to any Ugandan, anyone, free of charge. So our appeal to the patient is that before you go to a facility, a private facility, that is going to charge you and you will not be able to pay,
take use of government facilities.
Take use of government facilities, including the Nambole Auxiliary Treatment Facility. Because currently it had, on Friday, it had about 40 patients for an over 1,000 bed capacity facility.
40 patients out of 1,000 bed capacity?
Yeah, so only 40 beds were occupied.
Okay.
Yes.
Okay.
So there is more space to attend to any patient who feels like they have COVID symptoms.
Okay.
Yes.
And just a quick one onto the observation of the National Planning Authority. The National Planning Authority last week came out to introduce a COVID-19 projection of cases, the mode of projection. Is it something that the Ministry of Health is looking up to? Actually, according to the projections I've been following up, they projected between 4th to 10th of July, over that was around 7,000 cases being projected. But according to the Ministry of Health, from 4th, I calculated from 4th to 10th, the cases amounted to, that was for 4,000, leaving almost that 3,000, you know, leaving a gap between of around 3,000. Which entails that the projection between the National Planning Authority and the ministry, there's still a gap.
Of course, you know, the National Planning,
a huge gap.
The Planning Authority is in charge
anyway,
of,
it
is in
gave
charge
estimates.
of,
I don't
is in
judge
charge
them
of planning, so it shouldn't concern. For them, they say they guide the government.
Yes.
On how it should plan for the COVID response.
Yes.
So it shouldn't worry you, because for us we are dealing with the actual.
Okay.
What is happening? For them they are dealing
estimating
on a mathematical calculation to guide our response. So we appreciate what they do.
Okay.
And we continue using their data to ensure that we plan better for the population.
Okay. What I'm driving at is that actually COVID-19 cases are reducing. Am I right to say that?
They
Compared
are
to...
reducing, but still high.
Okay, okay.
Yes. And we expect a peak at the end of this month.
We expect a peak at the end of this month.
Yes.
And regards to the National Planning Authority, actually we expect a reduction.
Yes, so that's what I'm saying. They give that, but for us we deal with
You do
what
with the
we're- what
you
we're
do you
saying.
deal with facts.
Yeah. No, they also deal with facts, but theirs is always indicative.
Okay.
Like they predict the situation.
Okay.
For us, we are dealing with the situation as it arises.
Okay.
Yes.
And now as we conclude, Mr. Ainebiona, where do you see Uganda, or when do you see Ugandans living with the COVID-19 virus in our daily lives? We have countries like London now scrapping off COVID-19 guidelines, putting off masks and what.
Most of them have,
When do we see that in the country?
as and when the required vaccines are available for the 22 million people. That's when we shall also be like these other European countries who you've seen with spectators in the stadium. Like yesterday, it was the European Cup finals, Euro 2020, and the stadium was full, meaning most of the people in UK now are fully vaccinated. So if we reach to that level of vaccination coverage, then we also will find a situation where people are free to go on with their lives normally. So I appeal to the population, whenever it is your turn to get the vaccine, do not hesitate. But you take use
When
of...
do you see us getting vaccinated? I mean, all Ugandans getting vaccinated?
With the rate at which vaccines are coming, maybe in the middle part of the next year.
Middle part of the next year.
2020.
Can I say June next year, 2022?
Around that time.
That is when
why
we
we hope
expect-
to have, best if all our vaccines projections arrive in time. Yes.
Thank you so much for you having joined us this morning.
Thank you for having me, and it's a pleasure. It's my first time here, so I'm very grateful.
Okay, hope you have had a good one on your first time. And that has been Ainebiona Emmanuel, who is the PRO at the Ministry of Health, discussing on the follow-up of the vaccination procurement and processes in the country. My name is Rita Kabanyoro. Coming up is Sports in Business. Good morning.
Smart 24, driving business. Smart 24, driving business.
And 9 minutes past 10 o'clock in the morning is SMB, and I'm here to give you the latest from the local updates. We've had a conversation here with the Ministry of Health Public Relations, Mr. Emmanuel Ainebiona, and he has been giving us more details about the progressing vaccines as well as the increasing cases in Uganda and how they're trying so hard to fight the vaccine as the Ministry of Health. Now, right there, we're going to dive into our local updates as well as the foreign updates. I'm Jerome Posonko once again. Now, let's head into our first story as the private sector Foundation Uganda, PSFU, has launched an emergency drive to mobilize its members to lend gas cylinders to health facilities. Now, this comes after the umbrella body of private business organizations says this is aimed at supplementing government efforts to treat the critically ill currently in hospitals. Now, PSFU says it will collect and give the cylinders to medical facilities that will be approved by the Ministry of Health. According to the PSFU head communications, Catherine Mosoke, working in conjunction with the Uganda Health Federation and the joint medical stores,